Hello again, everyone. I'm Mark Mazzaferro, Communications and Media Officer with the City of Vacaville, and it's time for our daily COVID-19 update here in the City of Vacaville. And with us to help with that is Fire Chief Chris Conception. Chris, how are you today?
I'm doing hecka good, Mark. How are you?
It's good to hear. I'm doing well also, thank you. So, shall we just jump right into the numbers, the updates for the cases and other info here in Solano County?
Absolutely. So in Solano County, the number of confirmed cases went up by 1 to 181. The number of hospitalized went down 1 to 9. And then as far as active cases, there are 30 active cases, so that's a decrease of 5. And then unfortunately, as far as deaths are concerned, there's an increase of 1 to 3 deaths now in Solano County. The county website is showing that the status as far as the number of ICU beds and ventilators that we have available in the county are both good. So that's a good thing.
Yeah, the deaths, it was 2 people over 65 and 1 person between the ages of 18 and 64. So,
Yes.
For whatever that means.
Yes, I mean they don't give specific patient information. It's just the groups of the categories of ages basically is what they give.
Right. Yeah. And our number actually went down in terms of cases in Vacaville.
Yeah, we weren't given an explanation to that, but we did notice that there was only an increase of 1 case throughout the county of 180 to 181, but Vallejo and Fairfield both saw an increase of 1 while we saw a decrease of 1. So my best guess is that they mistakenly classified or attributed that 1 case to Vacaville when it should have been one of the other cities.
Check the wrong box.
Yes.
Okay, so let's get right to the questions and comments.
Sure.
A lot of discussion about antibody testing and testing in general. There have been 2 studies published, one by Sanford, another one I believe is out of USC, talking about the actual number of cases versus those have been tested, et cetera, et cetera. You want to talk about that?
Yeah, absolutely. So actually, I'm going to correct you on one of the terms, in that the studies have not been published, in that they're both still being peer reviewed.
That's right.
So
my apologies.
Yeah, no worries. But we need to clarify that just so that. Anyway, so there was the Stanford study was the first one, and what they did was they reached out via social media and they tested 3,330 individuals in Santa Clara, and then the USC study used a marketing company to get a certain portion of the population, what they call a representative segment of the population, and they tested 863 individuals, and they used the antibody test. So the antibody test tells you, have you had COVID-19? And the USC study indicates that in LA County, the prevalence of COVID-19 is actually 28 to 55 times more the prevalence of what is actually being reported. Whereas the Stanford study is, they said, anywhere from 50 to 85 times what the studies are indicating right now, and like I said, they're still being peer reviewed, is the prevalence of COVID is much more, indicating somewhere in the neighborhood of 2 to 4% of the population actually have had or have COVID-19 is what the studies are indicating at this point. But again, it's very early on in the process, and both studies are still being peer reviewed.
So not, I'm no numbers guy, but
Yeah.
to kind of dumb it down a little bit, certainly for me, if take the Stanford study, if we knew there was 1 case, 1 documented case, based on what they've found, there's probably more like 50 to 85 cases out there.
That's exactly what they were saying. So the number of cases in LA County were in the, I think, 2,000 range or something like that, and they're saying that there's more like 220 to 100,000, yeah, something, yeah. So,
Well, you know what they say about numbers, Chief. There's lies, there's damn lies, and then there's statistics, right?
yes, yeah.
So it's tough because I read both articles, and you mentioned the Stanford study was social media. The USC study was more scientific, if you will allow me that.
Right.
But at the same time, because of the variances in population and how the virus affects different groups of people, they've also made lots of adjustments based on that as well. So, I mean, there's always a margin of error in every survey.
Yes.
And the more people you survey, the lower the margin of error.
Right.
But, you know, and if you've seen a poll on election day or prior to election day, they always give you four percentage points plus or
Right,
minus.
there's
either way.
a wide margin there, and that's why in the Stanford study, they're saying anywhere from 25 to 50, what do they say, what are they?
Well, 25 to 80,
20,
I
28
think
to
it was.
55
Yeah.
times the number in the SC study, and the Stanford study says anywhere from 50 to 85
Right.
times. So there's that, like you said, there is a big gap, but regardless, I mean, it is good information to have. But again, it's still very early in the process, and the information will become more useful as it gets peer reviewed and we get more studies like this.
And the on its face, that tells us what? That there's more people that have had this or have it than we realize, and that
It indicates that COVID-19 is more prevalent in the community than originally thought. So what they're saying is anywhere between 2% and 4% of the population have actually been exposed to it already, or have built up an antibody to COVID-19. But that's still a very small number. So, I mean, you've heard people talking about herd immunity. We're a long, long ways from getting herd immunity.
Okay, now I'm getting this question a lot on our Facebook page about the recovery numbers.
Yes.
Now, I know the Johns Hopkins University website that has numbers worldwide used to have those numbers. It doesn't now.
Yeah, I tried clicking on that link because they still have a little tab on there yesterday after this question came up, and I'm not able to click on that link for some reason. And then as far as the numbers in the county are concerned, they don't report it.
They've never reported those.
And so we report the numbers that we get, and again, we've always said we're going to report numbers that we know have been vetted and come from a valid source. So yeah, unfortunately, they're not reporting that, so therefore we can't report it out.
Yeah, and I checked with county health too. I called them up and I go, did you ever have those? They never had
They have not
posted
had
those.
it, no.
And again, I guess it's important to know who's gotten better, but how does that help? I mean,
It doesn't really give you a lot of, knowing how many people are recovered from it. I guess it's a good thing to know, but it doesn't really give you any actionable information. If you
no,
will.
and I tried to do some math with this gentleman, and I hope he was patient with my efforts. If we said we had 180 cases and then we only have 35 active cases, then that means 135 people have recovered, or 36, whatever the number is. I don't even know if that's accurate, but
it's hard. It's hard to know because I mean those numbers aren't reported, and I don't know how they determine whether you've recovered or not recovered, and
right.
We report the numbers as they're given to us.
Right.
Yeah.
Okay. Question about social distancing. I can social distance in Costco and Walmart. Why can't I do it in a movie theater or a gymnasium? It's common sense.
I don't disagree with that statement, but we are, as a reminder, we are complying with the county order, and the county order says that Costco and Walmart are essential businesses. And I've been to Costco where they're very good about putting tape on the ground as far as being 6 feet apart from other individuals. I would imagine that as we start reopening the businesses, and when the county starts relaxing its orders, and And I got to tell you, I can't wait until the gym opens because I haven't been in the gym and I've been relegated to taking walks for my exercise. And I'd like to get back into the gym myself. But I would imagine when the gyms and the movie theaters open, we're going to be required to do those social distancing things. So, but we have to wait until the county relaxes their orders before that we allow that to happen.
Yeah, and I don't want to dig too deep into the whole theater issue, but you're pretty close to people in theaters. So every other seat, every third seat, every fifth seat.
Right.
I mean, at some point, it's not profitable for the theater to stay open anymore.
Yeah.
I guess anything's better than nothing, but.
Yeah, there's that too. And then you got to kind of think about, if you see the lines at Home Depot and Costco and all the big box stores that are allowed to stay open, and it's not just while you're in there. While you're in the movie theater, it would be real easy to impose the 6 feet social distance, but it's the lines to get in that makes it a little bit more difficult. The gym is going to be a little bit difficult because you're exerting yourself at the gym, and I don't know how they're going to do that, but I would imagine when the gyms are allowed to open back up, that I anticipate that we'll still have some social distancing guidelines that we have to follow.
Well, and again, I don't run a gym or a theater, but I would imagine there would have to be extreme measures put in place to assure that the equipment and the facility is safe to use. I mean, a gymnasium or a workout center, there's lots of sweat, there's lots of perspiration, there's body fluids.
It's the droplets, right?
The locker room, the showers, the pool, those that have pools. I mean, there's a lot of breeding grounds in gyms.
Absolutely.
So, I totally get the whole closure of the gym, so.
Yeah. I don't like it.
Who does? Nobody likes any of these
nobody
things,
likes it.
Chief.
Nobody
Let's
likes
face
it.
it.
You're right. You're absolutely
We hear
right.
it every day, and again. All right. Do we expect summer teams to get in this summer on time, or is there going to be a delay? I guess they're talking about some softball and baseball. And Little League and stuff like that.
We still don't have an answer to that. We're still discussing those. We're still awaiting, any word from the county. And as soon as the word comes from the county, we will let you know. So as soon as we get that information, we will pass it along.
Great.
Yeah.
Same with beauty salons. This is funny. I've seen this comment more than once about and heard from folks. I need to get in for a mani and a pedi, but they can't do that right now.
Yeah, absolutely. Yeah, I mean, and I'm gonna need a haircut soon. So I mean, I'm hoping
Lucky you.
I'm hoping the barbers will be allowed and the salons will be allowed to open up sometime soon. But again, we are still waiting. They're deemed non-essential businesses by the county order and as well as the state order. So we have to wait until they relax those a little bit. And once we know something, we will let you know.
All right. Anything else you want to add today, Chief?
No. Are you going to bring up the point that we're going to change the schedule up a little bit?
We might be changing the schedule
All right.
as time passes.
Okay.
We're doing it every day. We're probably going to scale it back a little bit. While there's lots of people that like what we're doing, there's some people who would rather see a different version, and we'll try to accommodate everybody as best we can.
Yeah.
Personally, I think you're doing a heck of a good job, or a heck of a good job.
Hella good job.
Oh,
yeah,
that too.
Oh, okay.
All right. Anyway, thank you very much, Chief.
Right,
thank you all for watching. We'll see you next time.